Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time. Today we will discuss about value codes in medical billing on UB4 claim form. Before that, we have to understand that UB4 claim form in medical billing is used by institutional healthcare providers, nothing but hospitals and nursing homes, facilities, and rural health clinics, rehabilitation centers, chronic dialysis centers comes into the institutional healthcare providers. And UB4 claim form is also known as a CMS 1450 claim form. So it is a medical claim form of CMS 1450 medical claim form. Here UB4 claim form is also known as a hospital billing claim form or institutional billing claim form. So here, yeah, UB4 claim form is developed by Centers for Medicare and Medicaid Services, and it is approved by National Uniform Billing Committee. So here UB4 claim form is maintained by National Uniform Claim Committee also. Here generally the procedure medical procedure code set is maintained by a American Medical Association AMA. So these are the basic information about claim form while we are reading. And UB4 claim form contains 81 locators or fields. Generally we can call it as a field locators, FL. So total 81 field locators are there on CMS 1450 medical claim form or UB04 claim form. So now in this video we will focus and we will discuss about the value codes. Guys, before we discussing about the value codes, we have to discuss about the box number 38. Here it is known as a responsible party name and address. Mostly this box is optional or otherwise it is blank. If applicable, only need to enter. So who is applicable means, for example, we have to enter the name and address of this particular box of the party responsible if different from the name in a box 50. So in next future slides we will discuss about the box number 50. It is simply it is known as a payer name or insurance name or entity name. So here in the box number 50 is insurance name. Mostly if it is the same, so that is what there is a not required to enter the details in the box number 38. If it is different, at the time we should have to enter the party name and address in this box. Mostly it will be the same, that is what it is mostly optional box. So just we have to note at this point. Okay guys, now we are discussing about the value codes. Here the value codes we can see on UB4 claim form from field location 31 to 31 to 41. So here from the boxes of 31 to 41 we can understand that these are the value codes along with the respective amounts. So there, here the value code is nothing but specific numeric code that identify data elements on a UB4 claim form. So we can understand that it is a specific numeric code. So generally by seeing this code we can understand what is the purpose of this claim. So and also for that particular uh, days or that particular code, there is a respective amount is also noted on that particular box. So that is called as a value code respected amount. So generally there is a code and amount, we have to understand that point. So here it is identify elements, in the sense we will discuss about right now what are the elements and how it is identified. So value codes are used to identify and convey additional information about the patient's care. So here I given few examples of value codes. So simply we have to understand that these value codes are used to identify the patient care, what kind of patient care is there. So by seeing that numeric code we have to understand, we means insurance will understand that this is a this kind of patient care medical service. So that based on that code insurance will understand and process the claims accordingly. So here example, the value code 81 I given the number of non-covered days. So for example, if you are submitting a claim, there is a specific duration to the patient care that we are not covered in this specific duration. If you are a billed this non-covered days, at the time we should have to enter code 81 so that insurance will understand that these are the number of non-covered days. So based on that patient care condition, insurance will process the claims accordingly. And also your, if the non-covered days, how many days are non-covered for that kind of services, how much of amount is charged by the healthcare provider, that amount also entered in that respective of code 81. So we are clearly intimating to the insurance that these are the non-covered days. For this respective amount we are billed this patient care. So specifically we are telling to you in the sense insurance, could you please could you please process the claims accordingly. So these are the non-covered days of specific time duration days, and these are the amounts for that specific non-covered days of treatment. So in that way we have to bill to insurance along with the insurance code, specific code along with the amounts. And also here the specific code 80 also I given the number of covered days, how many days this kind of specific care is covered for this patient, that is known by applying code, by appending code 80 on that respective value codes and amounts boxes. So how much of amount was charged by that provider, but that particular covered days during that specific time period, that will be known as a code 80 will explain to the insurance, so that insurance will understand and process the claims accordingly based on that specific time and amount, that specific code. Here also I given value code 83 as an example. It is a Medicare lifetime reserve days. So based on this code, insurance will understand these are the lifetime reserve days and also respective amount for that specific element. So based on that codes and amounts, insurance will understand of that particular specific data elements on that particular UB4 claim form on that particular boxes 39 to 41 and process the claims accordingly. Value codes and amounts required when necessary to process the claims. For example, you build a claim with the patient care services of Medicare reserved days, but you are not entered the respective value code in the box number 31 and 41, 31 to 41 along with the amounts, then insurance will not process the claim because your patient's care are telling, based on medical records, initially they don't know what you are billed. So by seeing diagnosis and treatment codes, CPT, procedure codes are nothing but ICPIC codes, the insurance will understand that okay, these are the Medicare reserved days patient care services, but you are not entered the respective value code in the box number 31 to 41, then insurance will not process the claim. So it is our job to enter respective value codes along with the amounts in box number 31 to 41 so that insurance will understand that based on the diagnosis and ICPIC codes, that revenue codes, then insurance will understand that this is the value codes based specific claim. So based on that particular element whatever we entered on value codes, that based on that information insurance will give the payments accordingly. So we have to enter maximum up to 4 value codes to identify the uh, special circumstances that may affect the processing of this medical claims. So I given information here that you have to see the NUBC National Uniform Billing Committee manual. So we usually you can find it on Google for specific codes, whatever the codes for what kind of specific patient care. So and also you should have to enter respective amount in the amount box. You have to enter the amount, exact amount of that particular value code. And whatever if for example the amount should be in a sense, you should have to enter like dot 00, that telling that it is cents. So you have to you have to enter respective value code along with the amounts. You have to note it down this point. Guys, if you are watching our video first time and not yet subscribed our channel, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that I mean turn on the bell icon so that you will get every our video as a notifications to your mobile. And if you felt content also useful, could you please like our video so that it will reach us many more needy people. Again, and thank you so much for your time. Thank you for your watching. Have a good health. Bye for now.